Hello students, welcome to this tutorial of pediatrics under the unit of the well child. In today's session we are going to look at physical assessment as well as growth monitoring of the child. So this particular unit is of very much importance because it detects some numerical values in order for you to know whether the child is growing fine or whether there are some underdevelopments in the child. So there are a lot of measurements that are usually done on the child to make sure that their growth rate is coinciding with their appropriate age. So as you can see in this slide, you can see that there is a mid-upper circumference mark measuring tape. So this measures the nutritional levels of the child, and it has its own readings and interpretation. If we can slide down here, you can see that in this slide, this particular person is trying to measure the head circumference of the child. So there are various measurements that are done on the child, and we are going to discuss them, discuss the normal findings, discuss the abnormal findings, because this is the only way amongst the ways that are there that can tell you whether the child is growing normally or not. So let me introduce you to today's topic under the well child, which is the physical assessment and the monitoring of the child. So we're looking at the physical assessment and monitoring of the child. So now we have two terms here. We have the physical assessment and the monitoring of the child. So there are some of the numerics or values that I'm going to be telling you, and you just need to make sure that you note them down. Okay. So in this session, I'm not going to write anything. I'm just going to say some numeric by my mouth. So under these two, physical assessment and monitoring of the child, we are going to start with the physical assessment, defining it, and look at the different parameters that are going to be assessed. So let's start with what physical assessment is. So what do we mean by physical assessment of the child? So physical assessment of the child is a systematic head-to-toe examination performed to determine the child's general health status, identify normal findings, and detect early signs of illness or growth abnormalities. So we are saying physical assessment is the process that is done in a systematic way. Systematic way, we mean that we follow things step by step that are done. You are going to assess the child, which you are going to call head to toe, from the head to the toe. You want to determine the child's general health status, and you want to find abnormal as well as the normal findings, or detect any sign of illness or growth abnormalities, as you can see. So this thing is so practical in a way that I can give an example. Let's say the child has come to the hospital and you want to do some physical assessment on them. We said you are doing head to toe examination. So you can start looking at the way the child is looking. Before you even touch them, you can tell that this child is not breathing well. You can tell that the child is looking pale. You can tell that the child is jaundiced. You can tell that the child is having is having some extra digits. Instead of 5, they are having 6. You can easily see those things. Okay? So this is what we mean on physical assessment. Things that you can see, things that you can use, you can hear, okay, and things that you can smell. In case someone is having the child is having nasal discharge, you can see it, as well as if there's any kind of smell, you can also smell it. Okay, so this is what we mean by physical assessment. It's a head-to-toe examination with the aim of finding any illness or abnormality. I believe that was okay. So now we must know that according to Wong, this is a book recommended for pediatrics nursing. Pediatric assessment must be age appropriate, gentle, and non-threatening. So remember, we are dealing with children, just like the pediatrics ward. When you go in the pediatrics ward, you see some the walls drawn with some cars or numbers or cartoons. That is just to make sure that the word is age appropriate, because it should not be threatening. So you want to create an age appropriate environment. Okay, so for example, you can't start getting blood pressure on an infant or a neonate. That's not age appropriate. Okay, and you must be gentle, because the organs of these children, they are not as compared to adults. So you need to be gentle, and you should be non-threatening. Speak in a calm voice, talk to them throughout the session, because they also hear. So tell them nice things as such. Okay, so now we want to look at the principles of pediatric physical assessment. What are some of the principles of pediatric physical assessment? In other words, we're saying, what are some of the rules that you should observe once you are carrying out physical assessment, the head-to-toe assessment? You need to perform assessment in a well-lit environment. Let it okay, so perform assessment in a warm environment, perform assessment in a well-lit environment, involve parents or caregivers to reduce anxiety. So remember, in the previous session that we were talking about normal stressors of children, we discussed the normal stressors of neonate, the normal stressors of school age going, the normal, specifically children overall in general, they have the normal stressor of separation. They don't like being taken away from their parents. So you should always involve the caregivers to reduce anxiety. If you are trying to inject the child, let the mother be there as well. That's just an assurance that no harm is going to be done, and they are going to accept it. There's going to be cooperation. And you should observe before touching. Okay, observe before touching. This is just a normal principle, a normal rule. Just like in when you are doing physical examination, you can't palpate before you auscultate, because once you palpate and then you auscultate, you are going to disturb the normal findings. So we always start with the least disturbing procedures, then we go to invasive ones. Okay, we come from non-invasive to invasive. So observing is non-invasive, touching is invasive. It can alter some more parameters. Use play and reassurance. Examine least disturbing parts first. And then the other principle is that you need to compare findings with the age-appropriate normal values. Remember, when we're talking about stages of a child, we have different stages of a neonate, an infant, school age, the preschooler, adolescent. So you need their parameters, they are numerical for different investigations. Okay, just like the way, for example, what we mean on this statement is that imagine in a case where you are measuring the respiration for a neonate and an adolescent. Definitely a neonate is going to have a lot of respirations as compared to an adolescent. A neonate is going to have about 25 to 30 breaths per minute, but an adolescent is going to have somewhere around 20 breaths per minute. So as someone grows, some parameters also reduces. So this is what we mean by comparing findings with age-appropriate normal values. Okay. So now we want to look at the general observation. Okay. On general observation, we are talking about things the mother has just come to the hospital with the child. Before you even start specific observation like abdominal examination, inspection, you want to palpate the abdominal. Before you do all those things, you want to look more like an overview of the general assessment. You want to look at general. Okay, so for the child, you're going to assess for levels of consciousness. Okay, is the child conscious? If they are conscious, there are levels of consciousness. Okay, activity and posture. Is this child able to move the limbs? Are they able to utter some words if that at all they have reached an age appropriate of saying some words? Okay, are they able to cry? Is the cry normal, weak, or it's shrill? Okay, when it's shrill, maybe you can suspect some respiratory distress or any other respiratory issues. Okay, are they able to interact with the caregiver? Okay, are they able to interact with the caregiver? You also want to look at the skin color. Is it pink? When it's pink, it's normal for a child. Pale, cyanosed, or jaundiced. This is what you want. These are the general observations that you want to do. These are general observations that you want to do on this particular child. You are going to assess for this. And then you are going to do vital signs. Vital signs in children. It's very much important, especially in pediatrics. They are going to, there's a certain point where in multiple choice they are going to ask about it could be ranges or it could be just the normal values for vitals in children. Okay, so you must know that vitals they vary depending on the age of the child. Okay, and the interpretation should be according to the age appropriate. It should be age appropriate. So the temperature, the normal temperature in children is around 36.5 to 37.5 degrees Celsius. I've seen this question in pediatrics so many times and they want you to state the range. So it's 36.5 to 37.5 degrees Celsius. This is taken from recommended pediatrics books. Whenever exam comes, the answer is 36.5 to 37.5 degrees Celsius. The pulse, you must be able to know that as the younger the child is, the higher the pulse. So if you get this, then you are not going to have a lot of issues in understanding the pulse, right? So now, pulse is just about when we look at the neonate has about 120 to 160. Okay, that's the neonate. Neonate has about 120 to 160. This is a pulse, which is the beats per minute. We don't take blood pressure in someone, in an infant, in a neonate. No, we just get the pulse. The pulse in an infant, that was a neonate, 120 to 160. Recommended books will show you that. Okay? Then when we go to respiration, before we go to respiration, we want to look at an infant. Okay? We started the neonate. An infant is about 110 to 150. Okay, it keeps on reducing when you go to preschooler, when you go to toddler. To toddlers, it's about 110 to 140 somewhere until you reach adolescent. In adolescent, it has now reduced. It is around 80 to 100 or 110. Those are adolescent. So you should know that the smaller the child is, the younger the child is, the higher the pulse they have. Then the respiratory rate is also higher in infants and young children. So adults have about the expression of about 12 to 20 breaths per minute. Okay, 12 to 20 breaths per minute. But with these infants, it's a little bit higher. It's about 20 to 30 breaths per minute. Okay, the respiration. And then blood pressure, you should take note that blood pressure can only be measured in older children. Okay, it can only be measured using the correct cuff size. Don't use an adult cuff size for children. So we are just talking about the older children who probably have reached the somewhere 14, 15. That's when you can use this. So and then you need to do the head to toe physical assessment now. This head to toe physical assessment is just like the way it is. You are going to start from the head and you are going to end with the toes. From head to toes, everything you are going to cover. But let's just talk about some pediatrics important findings in head to toe physical assessment. What are some of the things that they can ask you? Okay, so you must be able to note the head. Okay, the size of the head, the shape and the size of the head. It should be normal and symmetrical. Okay, head, you can measure the head circumference just like the way I displayed the what's this, one of the illustration in the preamble when I was introducing you to this session. Okay, you saw someone measuring the head circumference of the baby. So the head circumference of the baby is around 30 to 35 centimeters. Okay, and then we want to look at the fontanelles. The fontanelles, the anterior fontanelle should be soft and flat. Okay, just like the way I was saying, head circumference appropriate for the age. So these fontanelles should be soft and flat. There comes a time when they will close completely. Okay, around the when the child is in their 9 to 18 months. Okay, then these fontanelles can easily close. Then the eyes should be symmetry. Okay, and lead reflex should be present, no discharge or jaundice. So when we talk about the eyes symmetry, we mean that they should be in a normal alignment. They should be in a position that they are always in a normal human. That's what we mean by symmetry. Lead reflex present, we mean whenever you light the torch in the pupil of the child, you should be able to see something reddish orange appearance. That is just an illustration to tell you that the eye is able to work normally. Because for you to see the light, it means that the light went through the sclera and it has bounced back after hitting the retina. And that's how the physiology of vision is all about. So if you see that lady orange glow in the eye of the child, just know that the eyes are just working perfect. then there is no discharge or jaundice. Okay, jaundice is the yellow discoloration of the sclera when you talk about the eyes. Okay, but it can also happen on the skin. So we're just talking about the eyes. How about the ears? The ears should be proper position and the shape. You know the proper position where the ears should be. Anywhere else from where they are always be, then that's an abnormality. Or maybe the child has very big ears, or they have a very smaller ears, then that becomes a problem. Respond to sound, age appropriate. Okay, the child should be able to respond to sound. Okay, if you make some sound, they should be able to respond that they are able to hear. Then you know that, okay, there is no problem. Okay, they should be here. Okay, so this one was just a mistake. It should be another point under the nose. So how should the nose be? The nose should be patens, meaning that it should be open enough you can see it. Okay? No nasal flaring or discharge. Nasal flaring is when the nasal openings are opening wider and closes depending on their following their breathing pattern. That can mean that maybe the child is in a respiratory distress. Okay, so nasal flaring should not be present and there should be no nasal discharge. Then when you go to the mouth and throat, specifically in the mouth, the child should have pink and moist mucous membrane. It should be pink. It should not be yellow. It should not be pale. Okay. Presence of teeth appropriate for age. You know the teeth that are appropriate for the age. You can't have a 6 month child to have all the teeth in the mouth. Okay. No oral thrush or lesions. Okay. So oral thrush can indicate some kind of infection, maybe candida. So there should be no oral thrush. How about the neck? There should be no swelling or stiffness. Okay. And the trachea should be at the midline. The trachea should not be on the sides of the neck. It should be where it's always supposed to be. Then the chest and the lungs, the chest should be the chest movement should be symmetrical, not whereby the other side is moving higher than the other one. It means that someone is having somewhat respiratory issues. Normal breath sounds, no retractions or abnormal sounds. Then the heart should possess some normal heart sounds. There should be no murmurs unless non-pathological murmurs. Non-pathological murmurs can come in a case where, so murmurs are those sounds which makes noise when you are auscultating. So non-pathological murmurs are those which comes, maybe the child has a thin chest. If the child has a thin chest, you can hear those murmurs and you confirm that the child has a thin chest. Then you can know that, oh, these ones are just what? Innocent murmurs. Those are non-pathological murmurs. Not where the child's chest is wide enough to accommodate normal heart sounds, then probably there's a problem. And then we want to look at the abdomen. The abdomen should be soft and non-tender, meaning that when you touch it, the child should not feel pain. No distension. Distension, it can indicate maybe or intestinal obstruction or gastritis. Okay. Umbilicus should be clean in a neonate. It should not be dirty or show any signs of infection. How about the genitalia? The genitalia should have normal development for age and sex. Okay? Age and sex should have normal development. What we mean is that if they are a male, they should have a male genitalia. And looking at the age of a neonate, they should have a normal, a age-appropriate sex organ. Okay, not the child who is just a neonate and they are having already armpit hair, or maybe they are already having pubic hair. No, that's what we mean here by normal development of age and sex. Everything should be normal. Okay, if it's the male child, then the male genitalia should be of the smaller size and not bigger. Then taste should descend in males. So it's important that the taste descends in males. Them moving down, that's what proved to them that they have, you know, the way these tests, their development occurs on top, and what happens is that they descend down immediately the child is is born. So they should be there. That's a normal finding. Then when we talk about the limbs and the spine, normal movement, no deformities, and the spine should be what? Straight. That is going to rule out spinal bifida. If it is not straight, then the child is having some more spinal bifida. And then the skin should be warm and smooth, no rashes or lesions, good skin texture, meaning that once you try more like pinching, but don't pinch to make it painful, just more like try to pull the skin. And how is it looking? Is it looking like someone is dehydrated? Okay, if it's a normal skin texture, it will show and it will move back as quick as possible. You won't even know that you even pinched it. Okay, and then that was all for physical assessment of the child. Now, what do we want to look at? We want to look at monitoring the health of the child. Now here, we are just from physical assessment. At this point, I can advise you to pause for 3 minutes, maybe eat some snacks, drink some water, refresh yourself, and then come back for monitoring the health of the child. Okay, welcome back. So we are going to start with monitoring the health of the child. What we want to monitor the health of the child. So let's start with what is really monitoring the health of the child. So monitoring the health of the child involves a regular observation and recording of growth, development, nutritional status, and general well-being to detect deviations early. So there are some instruments that we are going to use in the monitoring the health of a child. These instruments, you must be able to know what instrument measures what parameter and what are normal findings. That's what we want in pediatrics. Okay, pediatrics nursing, we just want you to know some more danger signs in the child. Is the child going well, or is the child is not going well? We want you to be intelligent in those parameters. So now let's dive into this. So components of health monitoring, we have growth monitoring, we have developmental surveillance, we have nutritional assessment, we have immunization status, and we have detection of illness. So these are components of healthy monitoring. Okay, I believe you've noted them down. And also health education to caregivers. So this is what comprises the health monitoring. So we want to look at the importance of monitoring child health. How do you monitor child health? So the child, you want to look at the immunization status, right? Immunization status. Has this child fully immunized? Have they received all the vaccines that they are supposed to receive at this age? Okay. And then, in a case where I said growth monitoring, have the child been going for clinics under 5? How has been is the weight increasing, or decreasing, or it's not, or it's at stage development, then how has been the length? Because these children should grow. Okay, their growth hormones are still working, and whenever they are in suitable conditions, they need to produce the result. They need to grow. So you are going to look at all those parameters. Health education. Okay, you also want to look at you want to educate the parents on best health habits and etc etc. Now I want to look at what is the importance of doing all those. Okay, so early detection of growth faltering. Okay, you want to detect growth faltering. If the child is not growing accordingly, is not growing well, you want to monitor that. Okay, and then prevention of malnutrition. It might be the child is not receiving the balanced diet, and they might be malnourished. Okay, so this you will see different. I'm going to reference to this importance that you should know. Pediatrics is something easy because it's something that is done. It's something that we see. It's something that we have seen our mothers doing throughout. Okay, probably you, when you have your siblings, little ones, you've seen how moms take care of them, everything, what the health talks about, the health practitioner talks about them, medication and everything. So we just want to remind each other. Identification of developmental delays. So remember, when in under the same unit, the well child, we also started talking about developmental milestones. The child is growing, the child is, I'm going to start with the child is sitting, the child is growing, the child is able to stand with support, the child is now running. Okay? So those, we want to detect them. By the age of 6 months, we want to see the child able to sit with support. If they can't do that, meaning that it's a developmental delay. By the time they are turning a year, they should be able to stand. Okay? If they are still growing at 1 year and they can't even stand with support, meaning that they're developmental delay. And then we also want to evaluate the effectiveness of interventions. That's what we want to do. So if this particular mother comes to under 5 clinics, and me as a nurse have measured the weight and the length of the child, and I've recorded in their under 5 card, then I find out that the child haven't been growing so well, I'm going to advise the mother health education. I'm going to give health education. So make sure that you don't just depend on exclusive breastfeeding. You can also start supplemental, because the child has already turned 6 months. At this particular time, the immune system is able to defend the child. So you can start giving things external apart from the exclusive breastfeeding. So I also want to assess the next time they come, if at all they worked on all the interventions that I wanted to them to put in place. Okay, so that's one to evaluate if it's been effective, if telling them has been helping them. And then we want to promote optimal child health. We want to make sure that the child is growing under all necessary conditions. They are fully immunized, they are receiving health education on feeding habits, they are fully updated about the weight, the length, etc. etc. So those are some of the importance of monitoring child health. Maybe they might be the last one. Nope. So now we want to look at growth monitoring tools. What are some of the growth monitoring tools? We're just talking about what are some of the things that we can use to monitor the growth of the child. So growth monitoring tools help assess whether the child is growing normally according to age and sex. So we just want to evaluate different growth monitoring tools and then assess if they are able, if the child is growing Well, so we have weighing scale. This weighing scale is just there to measure body weight. It can detect weight gain or loss. Okay, and we have different types of weighing scales. We have infant weighing scale, and we also have standing scale for older children, whereby the child just stand on the scale. But for infants, you can just put them on the, because their weight is still their weight is still not that massive, so you can put them on spring balance and then you measure their weight. So procedures when you are doing the weighing scale is that always make sure that you zero the scale before use. Zero the scale. Zero the instrument has always been an emphasis, even when you are doing physics in high school. You always zero the micrometer screw gauge before use. You always zero vernier calipers before use. So even here, the scale, we must employ that knowledge and zero it before use. The importance of zeroing it is that you don't have that starting error. You don't have the margin error. Imagine the scale is already on 5 and then you want to measure the weight. It's going to lie. It's going to add that 5 as an error. They code weight accurately. You should be able to record weight accurately, because it's very much important, because if you don't record weight accurately, how are you going to track the normal development of the child? So this is one, we can take it as a major, as a general principle. Everything, record it accurately. Record everything accurately. So normal findings, you should have stayed weight gain according to the age. So the under 5 card is going to, the under 5 card has lines. Okay, we have the green line, we have the red line on top, and we have the black line. And so if at all that thing is coinciding with the green line, meaning that the child is growing. But if it's just stayed, meaning that the child is started, they have reduced growing. Okay, we also use another instrument apart from the scale, which we measure weight. We have what we call MWAC. MWAC, we call it mid-upper arm circumference. This one is a tape. What's the purpose of MWAC? It assesses nutritional status in children age 6 to 59 months. Those who are 6 to 59 months, 6 months to 59 months, they are ready for you to start them on MWAC. So usually MWAC, as you saw the picture that I depicted in the preamble when I was describing that tape, that is red, green, and yellow, the tape that. So the interpretation of MWAC are simple, and you must know them as a nurse. When it is greater than or equal to 12.5 centimeters, then this is considered normal, meaning that the child is growing under good nutritional status. But when it's in between 11.5 to 12.4, this is the moderate malnutrition, meaning the child is malnourished but not that severe. Then when it is below 11.5, then this child is severely malnourished and they need a nutritionalist in their plan for the food for them to be back again. So these are normal findings under MWAC, and is done in the mid-upper arm circumference. And then 3, we have growth charts. This growth chart, we have weight for the age, height for the age, we have weight for the height, we have head circumference charts. So all these, the weight should be appropriate with the age of the child. The height should be appropriate with the age of the child. The weight should be appropriate with the height of the child. And head circumference. The growth should be steady, not too much and not too little, because it can cause some problems. So the purpose is to track growth over time. We just want to know if the child is really growing. Identifying undernutrition or overweight, we want to monitor that. Okay? So whenever you are plotting those weight age, weight height, make sure that you plot correctly according to age and sex. You observe growth trends, not single measurements. So you need to make sure that you are also using the previous results as a what? As a point of reference. And then the fourth one, we have developmental milestones chart. This one is used to assess age-appropriate skills. Developmental milestones chart, meaning we have stipulated time when the child should attain everything that the child should do. Let's say the child walking, the child crawling, the child start talking, all those things. That's what we mean by developmental milestones. So these are just going to help to assess age-appropriate skills, help identify delayed development, identify normal findings. Simple, simple. Normal findings, weight and height appropriate for the age, active, alert child, normal vital signs for age, achieved developmental milestones. Okay, this is what we want to do. No signs of illness or malnutrition. Then we can say that this child has what? Has achieved normal developmental milestones. Now I want to look at the roles of a nurse in physical assessment as well as growth monitoring. What do? Perform accurate assessment. Perform accurate assessment for you to get accurate results. Use growth monitoring tools correctly. Make sure that when you are using each and every instrument is used correctly so that you obtain good results. Just like, for example, we're talking about the scale for children. You zero the instrument before measurement to get accurate results. Educate caregivers on child health. Okay, you need to give IEC, which is Information, Education, Communication, which is health education, to the caregivers. Whenever you see anything that is not done in the correct way, you address it. Refer children with abnormal findings. Okay? Make sure that whenever you see that the child is having some abnormalities, you refer them to the next profession or to anyone who is above you. And then maintain accurate health records. You want to maintain accurate healthy records. Everything should be done in an accurate manner. And this is where we are going to end today. In another session, we are going to continue with another topic. We'll be going on, and I'm going to make sure that I send some more questions on this particular topic. So make sure that you also go through, and then you try to attempt the question. Thank you very much for being with me.